it's my pleasure then to present the social innovation of Innovage called User-Driven Housing of Older People. And I'm representing the Department of Health Sciences and the Center for Aging and Supportive Environments at Lund University in Sweden. This work package was then led by us, but I also would like to acknowledge that we have partners in the Innovage Consortium from Germany, from Italy, and also a subcontractor from Latvia. So with that said, this work package had the ambition to not only study and develop and study a social innovation within one country, but also to test it in certain aspects across at least 4 countries in Europe. The basic idea of this social innovation is based on extensive research on housing and healthy aging among older adults in 5 European countries. And I have the pleasure to recognize several colleagues from that former FP5 project called the Enable Age that focused on these aspects of housing, like accessibility, usability, meaning of home, that is objective as well as perceived aspects of housing. And we do have a lot of results showing that there are very important such relationships. And they are then important for our social innovation. Like very old people with good housing accessibility and usability at home have a better sense of well-being and less depressive symptoms. Good housing accessibility is associated with more independence in daily life. And I would like to highlight that one because that links very nicely to Carol's presentation that we listened to earlier today. And also that accessibility, and in our project it's based on the notion of person-environment fit. I will come back to that a little bit later. Accessibility predicts falls among very old people better than the consideration of environmental hazards only. So with this as the empirical base, we then continued into our project, focusing on only one aspect out of many. As you can see here, it's only one piece out of what housing is composed of. And actually, accessibility is one prerequisite for housing supportive, active and healthy aging. Because if you can't get out and people can't get in to your dwelling, of course that is very negative for your social participation and other aspects of daily life. So the goal of our project is to use former research and a methodological platform that was available to develop an ICT tool based on needs of older people related to housing and the kind of needs that older people themselves identify. The conceptual foundation, the housing enabler methodology, is a methodology that is based on more than 20 years of research. The theoretical foundation is Lawton's ecological theory of aging, where person-environment fit is the basic notion. That means that the functional capacity of the individual, including use of mobility devices, is related to the demands of the physical environment, here illustrated by, as you can see, a stair. There are no handrails, and for people with some visual impairment, it's not so easy to overview this kind of staircase design. So this methodology has been established in close cooperation with actors in the healthcare and housing provision sectors, and the environmental component is based on national standards and guidelines for good housing design solutions. But as it was when we started this project, it was intended as an assessment tool for professionals to use and to assess environments as well as individuals. With this social innovation, we turned that perspective round to explore whether this kind of approach could be useful for older people themselves to address issues in their present or future housing situation. We started out with a project, a part of the work package that we call cross-national user participation. We used a methodology called research circles. Many of you are well aware of using focus groups. So in a way, this methodology resembles focus groups, but there are a couple of very important differences. One difference is that research circles is a collaborative approach. Researchers and in this case, older people and stakeholder representatives, they take part on equal terms and they collaborate through the process. While, as you know, focus groups, that is an interview methodology that is very much led by the researchers. Another very important difference is that in focus group, people represent themselves. We want to know in depth from people what they think about the topic, but here we need to have participants that can represent more than themselves. So, with this said, the goal was to generate knowledge on how senior citizens in different European countries express their needs and expectations regarding housing options. We also wanted to have data to be able to establish user requirements for the new ICT tool under development, and this was then done in Sweden, Germany, Italy, and Latvia. It involved end users, user organizations, as well as public and private stakeholders. Once again, I would like to emphasize that it takes a lot of energy to identify the right type of participants, to have this representativeness that goes beyond those individuals that take part. We had approximately 12 to 15 participants in each group, and you can see on the slide how the distribution ended up between different categories. It is very demanding, challenging, but also very encouraging and inspiring to work across countries in this kind of research. We use qualitative methodology for the analysis, and as you can envisage, having researchers and data then in different languages requires also that the team collaborates in joint meetings, data collection and so on, and we had a very structured process to be able to do this in a valid and reliable and trustworthy way. The main cross-national results were then the core set of user requirements for the development of the tool. It was to, according to the users, this tool should be able to detect, evaluate, and provide information on potential accessibility problems in current or available housing. It should be able to suggest or recommend possible actions to address such problems, and the interface should be easy to use and understand and accessible also for people with disabilities. As we did have this housing accessibility methodology already at hand, we also needed to collect valid data on real housing environments, and you will see that later why we need that. So we needed to establish a database with a lot of details about how different apartments look in reality. And in order for this innovation to be possible to scale up for the future, we also wanted to see whether we can train raters in the housing estate sector to make reliable assessments of housing environments, because formerly we had only used it with healthcare professionals. So we tested the feasibility of the methodology then outside the healthcare sector with employees from housing estate companies in Sweden, and we followed up after 1 year to see whether they had, what kind of experiences they had, and the main result was that they saw the methodology as a valuable tool in their professional work. And we actually already before this project started had a reliability study showing that this is possible to do with sufficient quality. So then, based on this, we also went on to establish an apartment database to be able to really test the innovation in a realistic manner later on. So we had access to data on 364 apartments already based on earlier projects, and then we tested data collection capacity in real estate companies within this project. So we assessed 46 apartments, or they did for us, and they actually represent approximately 400, because as you know, we often have the same type of apartments we have many of the same type in that kind of housing sector. And this was then done in Sweden as well as in Latvia. And so we went on to develop the ICT tool prototype based on those user requirements, with the Housing Enabler as the methodological platform, and with this database on environmental barriers as the empirical pool of data on barriers in housing. It was developed as an Android app prototype, and actually it is existing now. You have it down there in the corner, so I hope that you will have a look at that during the lunch break. First, we used a team of students to set up the basic structure for the app. We employed a computer science engineer who then have been working with us since then to develop the prototype. And we had an iterative process with redesigns where we involved older people in that process. And we had frequent and regular meetings in between the researchers involved to test different and alternative solutions. And we also have our case board of users in our center, actually with the chairperson here, Bengt Holgersson is in the audience, and we also had a possibility to present the app to the user board to get that kind of input during the process.